Khan, and I'm going to talk to you about vaccinating the world against COVID-19. Recently we heard the MHRA, the governing body in the UK that regulates medicine safety, gave its seal of approval to the Pfizer COVID-19 vaccine. The FDA in America and the EMA in Europe are likely to follow suit in the coming weeks, and we've also got the AstraZeneca Oxford vaccine and Moderna vaccine hot on the heels. So how do we get everyone vaccinated? Well, we don't actually have to get everyone vaccinated. We need to make sure we hit a certain threshold of the population to ensure enough people are vaccinated and immune for herd immunity. That means those people who can't have the vaccine, perhaps for medical reasons, are protected by those who have had the vaccine. We also need to make sure that enough vaccines are being made. This is why we've got lots of different vaccines in the pipeline and production has already started on them. We also need to ensure we have the appropriate workforce in place. This might mean frontline healthcare workers, but it could also be training people who haven't given vaccines before to give vaccines now. And it could also mean people who have recently retired from the healthcare profession to come out of retirement, nurses, doctors, other healthcare workers, to help drive this forward. A really important part of getting everyone vaccinated is to make sure people want to get vaccinated. And that is fighting misinformation out there about this vaccine. There is so much misinformation out there which might put people off and scare people into not having the vaccine. And governments across the world have got to do something about it. Cost is a major issue. We have got to make sure that countries who may not be able to afford vaccines can get this. And that's where the World Health Organization and other global bodies come into play. COVID-19 will only be eradicated worldwide if all countries in the world who have been affected by it are able to access the vaccine and relevant healthcare thereafter. And that might mean not just getting the vaccine to those countries, but the workforce to deliver it to. Now, I'm an NHS doctor. I'm ready to vaccinate when I'm called up. I'm also ready to take the vaccine when it's my turn. I believe it is safe, and I hope you do too.